It has been a pleasure at this workshop. This 2 days has been a tremendous, I think, intellectual experience, both to learn about the research questions that are being dealt with, and also, I guess, the questions that come from the programs. So I will be talking about the new methodological directions that I think the program envisions as including both statistical methods and technology, and I guess the integration of the two, because that is really the key to the success of the development. Okay, so I have a brief outline here, and in the interest of time, I will skip over some of the topics. So there was a very nice methodology chapter in the 2009 IOM report, and so I think I will not repeat a variety of issues that were already covered in that chapter. That includes like Hendrik's very nice work on dynamic waitlist design, which is also known in the literature as a stepwise design. Developments in multi-level growth modeling, which has proved to be very useful for prevention research. And so this talk, I will focus mainly on the statistical methodology topics that were not already highlighted in the 2009 report. And I guess Hendrik and I have some text that we will put into the workshop's summary report and to relate to the previous report. And the next topic I will talk about the need to match study designs to address the broad arrays of research questions that are arising as the field moves from treatment development, efficacy research towards implementation, dissemination, and quality improvement. And I think we had a lot of discussions since yesterday about the new research questions that we are facing. And I guess it should be clear that the standard two-arm randomized control trials have been a very useful tool for treatment development, for efficacy research. But no study design should be considered as a panacea for all research questions. We definitely need to find the treatment that tailors to the condition we're trying to treat. Therefore, there are a variety of very exciting new study designs that have emerged in recent years, or some that came from other fields like engineering and marketing that are being used more in our field. I will talk briefly about mixed methods and advances in technology to echo what David's nice presentation talked about. And then the last section of the talk will go over what I call small data applications for implementation, dissemination, and quality improvement to address the local needs for the issues that we have been talking about since yesterday, about the need to have good methodologies to do adaptation, to use local data, to do local planning. And I think Bill Bisley made a very succinct comment yesterday that all healthcare is local. And so I have some discussions. So I'm going on to Stacy, is a slide? Can you control the slides from there? No, actually, I'm going back. So let's go to the original sequence. Let's go back to number 5. Okay, so this is the point I made earlier about the need to match study designs to research questions and go beyond the standard two-arm RCTs. And so with, I guess, a broad range of research questions we're addressing in comparative effectiveness research, implementation, dissemination, and quality improvement, we should look carefully at alternative designs that could be used to address those questions. For the interest of time, I will skip a section on pragmatic trials, and I will focus on factorial trials and the SMART trial. Do I have control over the slides now? Okay, so factorial trials are multi-arm trials that try to look at multiple components of the intervention, which could be a treatment program, or it could be an implementation strategy. So testing multiple components at the same time allows us to get an understanding on a variety of issues to design and optimize such multi-component interventions. One type of specific applications is to try to identify the key ingredients for the multi-component intervention, to identify what components are essential that needs to be maintained as much as possible, and what components might be less critical, might be optional. This kind of goes to the nice point that Charles Collins made yesterday about recognizing the need to have half full bottles. And those designs can potentially help us appreciate which half of a bottle is important to keep full and which half might be less critical. So there's some very nice work done under Linda Collins' research group at Penn State, and they developed a methodology that they call the multi-phase optimization strategy that uses factorial trials to address those issues. And another application of factorial trials that has been used in prevention research is to use tools from market research. Like one of them is the conjoint analysis, which is a factorial trial embedded in consumer surveys. So within a survey of the potential consumers for a intervention product or implementation strategy, we make up a variety of hypothetical configurations of the intervention or product, and ask the consumers to rate or rank those products. And from there, we try to infer what features are the most important for the consumers and what features are less important in order to help make the design decisions, what feature needs to be emphasized in the intervention being developed, and which features might be less critical and can be left as optional. So one of the nice review papers was published by Sunjae Lee from UCLA a couple years ago in the International Journal of STD and AIDS. Another very exciting methods development in recent years is the sequential multiple assignment randomized trial, or SMRT. And those trials are developed to evaluate dynamic treatment regimens. Those are very similar to the, I think, the dynamic treatment modules that Bruce was talking about earlier. And this is, in the statistical literature, this is also sometimes called adaptive treatment strategies to inform multi-stage treatment decisions. So, so instead of the usual clinical trials where we evaluate two treatments, which one works better or not, the SMART tries to develop a treatment sequence. So first try which would be the best first-line treatment? And then if the first-line treatment fails, what would be the appropriate second-line treatment, etc. And the statistical methods developed has been led by Susan Murphy at the University of Michigan, and she did a lot of collaboration with Linda Collins. And Susan was awarded a McCarthy Fellow Award just recently. I think she's probably the fifth or sixth statistician to receive that award. That I think is really compelling recognition of her contributions and the promise of the SMART approach. I believe there's a lot of synergy probably between Susan's work on SMART and the work that Bruce talked about earlier. And I don't know, Bruce, whether you already know about Susan and her work. If not, I would love to introduce Susan to you. Hopefully there will be some exciting collaborations. So back to my outline, talk briefly about mixed methods. So there's a tremendous potential that mixed methods that integrates qualitative methods and quantitative methods can be very useful for implementation, dissemination, and quality improvement. And my colleagues, Carla Green et al., recently published a paper in administrative policy mental health, which is not yet in print. And another, I think, very interesting collaboration that Larry Palinkas and I and Kimberly Hogewood and Dulab Baumrick at the University of Illinois Chicago did recently is this paper on optimal design and purposeful sampling. That is potentially a very useful tool to try to help guide study design decisions, both for sampling and maybe for experimental design, for study, especially for studies with multiple objectives, and which I think is very common for implementation and dissemination. A study might try to do several things, and the usual way I think maybe the statistical literature deals with study design for multi-purpose studies is usually to identify the primary aim and then power the study, design the study based on the primary aim. And that is a good idea if the primary aim is really dominantly more important than all the other aims. But there are many situations in implementation and dissemination where multiple aims are all important. Maybe not equally important, but they should all be considered simultaneously. And the optimal design is potentially a very useful approach to try to compromise. Oh, I should have mentioned, the multiple aims sometimes might drive different designs. And so, in a sense, we have a methodological conflict. And optimal design is a way to achieve the compromise across the different methods. Advances in technology, I think David gave a very thorough presentation. And I think there's tremendous advance in recent years in information technology, in sensing technology that facilitates both the delivery of intervention and also the data enterprise, assessment, statistical analysis. So this technological advance make it possible to do things that might not be thinkable 10 years ago or even 5 years ago. And one of the, I think, very important features about the technology advance, as David discussed earlier, is that the ownership of the technology is becoming more and more distributed. We are not moving towards a bigger and bigger mainframe. I guess the mainframes have been gone for many years. And instead, each and every one of us, and I guess the service agencies, the schools, have the hardware and software that potentially could be used to do a lot of the data management, data processing, the learning process. When I was at UCLA working in Mary Jane's group, several of my collaborators at UCLA, led by Sung-Jae Lee, we did a very interesting pilot study together on a technology transfer program to train HIV service provider agencies to use Microsoft Excel to do some simple, basic data entry, data management, and basic statistical analysis. And the training was very well received. And I believe that kind of technology transfer potentially has a promising role in implementation and dissemination, because this is the way, I guess, to mitigate the methodology statistics as a barrier, but instead we empower the agencies who are working in the field to have access to the methodology. There's no need for Columbia or UCLA to monopolize this methodology. And so the agencies can be an active part of this learning process, and potentially that will give wider use of the methodology. Okay, the next section is this small data application. I think I'll skip a couple of the less critical slides and go to where I think a lot of discussions were focused on yesterday. So the methodology for local investigations. I think since yesterday there was a lot of very nice discussions about the potential use of local data for local planning or decision making. That is an issue I think the statistical community has a lot to work on. The statistical methods have been, over probably the last 5 decades, been dominated by the research that aims to produce generalizable knowledge to export to consumers outside of the research. So the typical, I guess the business model, we could characterize it as an export model. So typically, we have study sites where we recruit patients and do the research, and then the knowledge gained is extracted and exported to other sites, to other patients. I think that's the discussion that we started from yesterday about the needs for implementation, dissemination, and quality improvement. I think I'll suggest that there is very often a need for local investigations that address the local issues. And I've come across many occasions when I had opportunities to work with service agencies. And you statisticians just want to do your research, take our data away, and you don't care about all issues. But we can be a helpful partner to address the local issues and help produce the local knowledge for the local agency, for the schools, for local consumption, to address their local needs. So here, the meaning of local can be a practice network, an individual practice, an individual patient. And this is not an area that the statistical methodology has focused on over the years. And this is an area that I believe more methodology development is needed. Here, definitely mixed method is potentially promising, and I also believe that the statistical investigations can be utilized more broadly to address those needs. And we are running pretty late, so I think I'll skip over the details and refer you to a paper that my colleague Ken Chung and I published in AJPH just recently on this topic. Okay, I've done a fair amount of work on single patient trials, or also known as N-of-1 trials. Here, the same methodology could be used by agency or schools as single agency trials. Those are multiple crossover trials, and that try to compare candidate intervention options, which could be implementation procedures. So those are a couple of the recent literature that I was involved in. And I'm currently working with a number of colleagues on this PREEMPT study, which started about a year ago. And the first year of the study is infrastructure development. We are developing an app for the Android phone to do the IT work, to do the statistical work, so to do what David talked about earlier, to do the engineering work to make it easy for the users to use the methodology. So the app allows the users to design their single patient or single agency trial, and to deliver the intervention, and to assemble the data, and to analyze the data, and then produce reports back. And we're just about to start on a randomized study to compare patients randomized to the single patient trial module versus usual care to evaluate whether this module indeed produces good outcomes. So a brief discussion. I think the advances in methodology, starting with the 2009 report, have contributed greatly towards the advances in prevention science, especially now. I think there's a lot of work that can be done to further integrate and develop methodologies for implementation, dissemination, and quality improvement. A couple of notes I talked about during discussions earlier. I would believe that there's a very promising opportunity for statistical methods to be incorporated into the toolkits or the technology transfer capacity building for the implementation and dissemination partners, to help empower them, to help make things easier for them to do the work, and to move the field forward. And given the, I think, rapid and also very exciting advances in methodology, both statistics and technology, I would not recommend, but suggest that the forum consider hosting a workshop somewhere in the future devoted to the methodology issues. Thank you.